Hi once again. Today we will do another 5Q podcast about common surgical conditions. And the topic for today is about surgery for gallstones. Starting off with the usual scenario. The first question: what are gallstones? Gallstones are a common condition in which literally stones form within the gallbladder. The gallbladder is an organ usually present on your right side of the tummy, just underneath the liver, which is used for storing and concentrating bile, which is produced in the liver. Gallstones are literally sand or stones which form within the gallbladder, which are usually made of cholesterol or what we call pigment stones or a mixture of both due to various causes. They can either be just lying there without any symptoms, and it's found only when you do an ultrasound for some other problem, or it can cause problems. Going into the second question: how do you treat gallstones? Not all gallstones need to be treated. They need to be treated only if they cause symptoms or if we have complications such as infection or blockage of the bile pipe, jaundice, or a potentially serious condition called pancreatitis. So the key is symptomatic or complicated gallstones need treatment. The gallstones which do not cause any problem need not be treated. Question number 3 is about surgery. Surgery for gallstones is what we call cholecystectomy or removal of the gallbladder, which is usually done through the keyhole approach and is hence called laparoscopic cholecystectomy. Question number 3: how good is the operation? The best and the most effective operation for treatment for gallstones is removing the gallbladder, which we called laparoscopic cholecystectomy. It is one of the commonest operations in general surgery, and I worked in a high volume hospital which we used to do about just under 1,000 operations a year. So you can see how common an operation, and an operation would not be common unless it's good. So it is a good and effective treatment for gallstones. Question 4: how safe is this operation? Once again, it is a very common operation, and the safety profile is so good that laparoscopic or keyhole surgery for gallstones is the gold standard for treatment of gallstones. It is a very safe operation with very minimal complications, and it is something we recommend routinely for the treatment of gallstones if they are symptomatic. So yes, it's a very safe operation and a routine operation. The final question is side effects and complications. We do have potential complications as for any keyhole surgery, such as conversion to open surgery. There's a small chance of bleeding, infection, which can also happen after any keyhole surgery or any surgery for that matter. Specific to gallstones or gallbladder surgery is a very rare chance of injury to an important structure called the common bile duct, which can happen about 1 or 2 in 1,000 chance. Small chance of stones slipping into the bile pipe, which might need further procedures in the long term, can also happen. Side effects in the long term, usually very minimal. People can go on to a completely normal and sensible diet after surgery. They can have things which they used to avoid or they were afraid of prior to having surgery, but being safe and sensible. There is a small chance that some people get diarrhea after this operation for unknown causes, but otherwise it is a very common, safe and effective procedure for treatment of gallstones. I hope you've had some enlightenment about the gallstone surgery, and thanks for listening. Bye bye. Have a great day.